In this session, we will discuss the role of leadership in the culture of the organization. By the end of this lecture, you should be able to meet the following lecture objectives: describe how an organizational culture can influence leading a team, apply cultural considerations of the role of a nurse leader, and evaluate the individual and societal factors involved in cultural diversity. We often hear the term organizational culture. Here's what it means. I know you have all been in some organization where you had an instant feeling about its formality, concern for others, belief in the mission and vision, and so forth. When the behaviors match the values, managers rejoice, and people are living the mission, and so the idea of what is printed is clear in the care delivered. When the behaviors don't match the values, there is much work to be done. This dissonance between the written word and how people actually perform makes everyone uncomfortable. No organization is going to rewrite its mission to match what is evident in behavior. So it is clear that it takes considerable effort to change people's attitudes and behaviors to match the organization. In general, when such discord exists, the employees need assistance in knowing what the mission means, or some organizational practice that is seen as hypocritical by employees must change. The values and beliefs and how they are enacted are also evident in the characteristics of the organizational structures. The organizational structure is difficult to understand because of the size of and complexity of the organization. The structure of cultures differs a great deal in philosophy, and the structure is called the soul or personality of the organization, and there are unique constellations of roles, forms, and values. It is important as a nurse to understand the basic concepts of culture. Understanding the principles of culture will assist you to understand how people shape their behavior, controls individuals' responses to each other, and shapes their outside world's perception of the organization. Nurses need to provide care that is appropriate to the client's culture. Some of the terms relevant to culture principles in care include cultural competence, which is care that is sensitive to issues related to culture, race, gender, and sexual orientation. Cultural diversity, which comprises a vast range of cultural differences among individuals or groups. Cultural background, which is a fundamental component of one's external and internal distinction. Cultural sensitivity, which involves affective behaviors in individuals, involves the capacity to feel, convey, or react to ideas, habits, customs, or traditions that are unique to a group of people. Ethnosensitive care is the ability to appreciate values and behaviors within the context of specific cultural norms and to apply this ability to practice. Can you think of some of the things that are direct or indirect coercion in relation to cultural diversity in the workplace? So indirect coercion in relationship to cultural diversity are negative biases toward a minority nurse, or negative attitudes and impact on the nurse's delivery of patient care. Direct coercion in relationship to cultural diversity are behaviors that are either subtle or overt, actual occurrence or perception, and are intentional or accidental. So can you think of some of the responses to coercion that are both positive and or negative? There are behavioral responses to coercion as well. So think about what forms of coercive control power are being exercised by whom and in what role context. So in a negative response, you see frustration, anger, passive aggressiveness, avoidance, manipulation, defensiveness, domination, verbal retaliation, inflexibility, intolerance, backlash effects, and many others. Some positive responses to coercion would be cultural sensitivity, self-examination of one's personal and workplace values, beliefs, and prejudices. There's mutual communication, such as respect for differences, honesty, and integrative solutions that would be a win-win. And the richness of the cultural differences requires deliberate effort. We're going to turn now to a case study in the next 2 slides. So Muslims are one of the fastest growing populations in the United States. Al-Gindi describes Muslim nurses' dress requirements and the role of Islamic beliefs in their lives. A Muslim nurse wore her hijab to the workplace while providing nursing care to patients. This nurse became frustrated when the infection control staff consistently asked her to wear short sleeves and roll up her sleeves. The Islamic dress code of wearing a hijab is considered mandatory. It is a way of life to obey Allah. So consider the impact of the hospital policy on nursing staff dress code. Does the hospital have policies on dress code that have cultural considerations? Consider what role do concepts about culture have in this case situation. Think about what sensitive or controversial issues are often addressed by behaviors that represent coercion. The first individuals in most organizational structures who have to address cultural diversity are the leaders and managers. They have to give unwavering support to embracing diversity in the workplace rather than using a standard cookie-cutter approach. Creating a culturally sensitive work environment involves a long-term vision and financial and healthcare provider commitment. Leaders and managers need to make the strategic decision to design services and programs, especially to meet the needs of diverse cultural, ethnic, and racial differences of staff and patients. It is important as a nurse to understand the basic concepts of culture. Understanding and valuing cultural differences benefits both patients and colleagues. Culture is a broad term encompassing many diversities. This broadness both enriches our perspective of diversity and provides a complex challenge.